So what are the different laser treatments that we have available for your face? So I think the easiest way to do is first break it down by ablative and non-ablative, and then we'll sort of dig into each one a little further. So the non-ablative treatments, which have no downtime, would be the broadband light treatments. So those are a bright light that treats the red spots and brown spots without burning your skin. I have a whole video that explains broadband light treatments, but in summary, they are non-ablative treatments, meaning they don't burn your skin, and what they do is treat the uneven pigmentation within your skin, the red spots and brown spots. So that is broadband light treatment. Now, the ablative treatments kind of come in 4 different flavors. There is the halo, there is the profractional or fractional treatment, there is the deep erbium laser resurfacing treatment, and there is the nano peel. So in general, with these ablative lasers, it kind of comes down to recovery, meaning the more result means more or longer recovery. So if you want a dramatic improvement, we're going to have to burn your skin deeper, which means you're going to have to take longer to heal. There is no shortcut when it comes to treating the texture of the skin with lasers. Or in other words, a short recovery means a lesser result in general. So the least, I guess, deep or the most shallow treatment with the shortest recovery would be a nano peel. So this is a full field ablative erbium treatment that does not go very deep. So it's similar to probably a light chemical peel. And what that does is it cleans up the very top layer of the skin, similar to a light chemical peel. And that is essentially what the nano peel is. It's rather quick. The recovery is pretty fast. You can wear makeup within a day, and that is what the nano peel is. Nano meaning it does not go very deep at all. The next level of treatment would be the halo. The halo is a hybrid laser that serves to smooth out the texture of your skin, as well as tighten up and thicken up your skin a little bit by encouraging collagen formation. That treatment generally has a downtime of 3 to 5 days, depending on how high we turn up the energy with the halo treatment. Your face will look very red and swollen initially, and then the redness and swelling subsides over the next few days to a week. So that is the halo treatment. It's sort of a long weekend recovery, and it improves the texture and quality of your skin. The next level would be a deeper profractional treatment or a fractionated treatment. This is the erbium laser, and it essentially drills holes of a specific depth and density like a fractionated laser does, sort of like the pixels on your TV. And that serves to, again, improve the texture and quality of the skin with a slightly longer downtime, closer to 5 days to a week in length. The most aggressive and most effective laser treatment of all would be the full field erbium resurfacing laser. So this is a full field ablation. It is not fractionated. It is tunable, meaning I need to go deeper in thick areas that have lots of wrinkles. So around your mouth is generally where I go the deepest to help get rid of those deep wrinkles around your mouth where the skin is very thick. And then I do not go very deep around your eyelids because the skin is thinner and we don't need to go as deep. So with the full field erbium laser, I'm going to specifically treat different areas of your face differently, but it is a deeper treatment, it is a deeper burn, and it is going to take 7 to 10 days to heal from that. And after you heal, those initial 7 to 10 days, your face is going to be weeping and moist, and you have to keep it very moist all the time so it doesn't dry out, and you're gonna look absolutely awful for that first 7 to 10 days. I'm not gonna sugarcoat it. And after your skin has healed, which takes 7 to 10 days, then you need to wear sunblock and avoid the sun as much as you can. But at that point, you are able to wear concealer if you would like, once the epidermis has healed over the top. Your skin will be red for another 1 to 2 months sometimes. And again, that can be covered up with concealer. But if you really want to smooth out some deep wrinkles, we need to do a deeper burn, which means you need to have a longer healing time. And it also means your face is going to be a little bit red or erythematous for a while after that. One other thing that I want to add about the different laser treatments to the face is that in general, the pain after the treatment isn't all that severe, meaning the majority of the pain that you would experience would be during the treatment, and we do everything we can to minimize that pain. In other words, if you're not having a very deep treatment, in other words, you're only having the nano peel or the halo, we have this amazing topical numbing cream that we will put on your face for about 20 to 30 minutes before the treatment. And most people don't have any discomfort during these treatments after they've had the topical numbing cream on for a little while. If you're having a deeper treatment, such as the full field erbium ablation or a aggressive profractional treatment, in that case, I'll start again with the topical numbing cream to do most of the work. But because we're going deeper, I will then infiltrate lidocaine solution with a needle. I'll actually inject it into the tissues to add additional anesthesia. I'll also perform nerve blocks to again further numb up your face before we do the deeper treatments. Once you're completely numb, there's not a whole lot of pain with the laser treatments, and once the numbing medicine wears off, it feels like a really bad sunburn. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.